My name is Allison Bowl. I'm a planner at Aging and Disability Services. Aging and Disability Services is the designated area agency on aging for Seattle and King County. So we're also the sponsor of the Community Living Connections program. This presentation is going to be an introductory overview of Community Living Connections services, as well as resources for staff and partners in the program. So what is Community Living Connections? Well, first, for some context, one of the key roles of an area agency on aging is to be a focal point in the community so that any older adult, adult with disability, or their family member can receive access to information, resources, and personalized support. In Washington State, those focal point services are termed Community Living Connections. And in our local community here in King County, Community Living Connections is a network of partners rather than one location or contact. Community Living Connections is guided by the vision that all older adults, individuals with disabilities, and their families have the supports and services needed to thrive in King County. The program blends funding and services to provide a continuum of support for those populations. At the lightest touch, these populations can receive information, referral, and assistance accessing services. And more in-depth services and personalized support is available, including specialized services for caregivers. We're going to talk more in depth about those other services later in the presentation. So how does it all work? Well, to start, anyone with an aging or disability related issue can contact Community Living Connections Central Access. All calls to these numbers are free and confidential, and callers are connected with a specialist who can answer their question and link them to resources and services. The staff at Central Access receive specialized training on aging and disability related issues. And they also share access to a comprehensive resource database and peers who are knowledgeable about a range of human and health services. So Central Access can be a gateway to the suite of services provided by the Aging and Disability Network. It includes screening for Medicaid long-term services and supports, and screening for community living connection services, like care coordination or caregiver support. But screening's not limited only to aging and disability services, and people can be connected to resources for housing, health, legal needs, or other services. These services are provided on phone. There are also electronic communication options available. And the phone line is operated Monday through Friday, 8 a.m. to 6 p.m. with an option for callback available. The next step for a client after Central Access may be any one of the contracted community agencies in the Community Living Connections network, particularly if more hands-on assistance or in-language support is needed. But these agencies may also be where someone's journey begins because Community Living Connections uses a no wrong door approach to connect people to services. So people can get the information and help they need by contacting any provider in the network. So they don't need to start at Central Access if one of the contracted Community Living Connections agencies is familiar and known to someone. Today in 2023, there are 19 contracted community agencies as well as aging and disability services. Agencies are providing services in multiple languages, and the services are tailored to specific communities and also specialized issue areas, for example, transportation. If a provider doesn't know how to help a participant or doesn't have the capacity, for example, to work with a participant in their language, they can troubleshoot an issue, explore different solutions, and connect someone to the agency who is most suited to provide support to a client. Services and community living connections are provided over the phone, electronically, or in person. In-person services can be at an agency's office location or another community location where an agency has a physical presence. So for example, Together Center in Redmond, many of our community living connections partners have physical office space there. In-person services can also be in another setting of a client's preference. There is a map of community living connections advocates on the Community Living Connections website. The map utilizes information provided by contracted partners, and users can find support by language or location and receive contact information. So this is another way that someone in self-discovery or research may be connected to community living connections. And we know that many older adults, people with disabilities, and caregivers are accessing services through other organizations who aren't contracted community living connections providers. So this includes libraries, housing providers, healthcare, first responders. So with that in mind, Community Living Connections region coordinators play a key role in supporting no wrong door access to supports. Region coordinators create networking opportunities for aging and disability providers and other organizations serving these populations. So contracted and non-contracted partners. Through regular networking meetings, agencies learn about resources and each other. So the idea is that an agency may not have all the answers, but they have the relationships that they know who to call to support a client who maybe has come through their door or contacted them. There are 3 regions in King County: North King County and Seattle, East King County, and South King County. Sun Generations is region coordinator for North Seattle and East, and Neighborhood House is region coordinator for South King County. Now we're going to look a little deeper at some specific services in the Community Living Connections program. We're going to start with services for older adults, adults with disabilities. And the first service that I'm going to be speaking to is information and assistance. This service provides information to older adults, people with disabilities, or their representative. It includes helping someone obtain a service or complete a task if they're not able to do so themselves. Agencies are screening people to determine what services they're eligible for and refer them to the appropriate service. One-on-one assistance may also be provided, and that can include translating documents, filling out forms, writing letters, making phone calls on behalf of someone, setting up appointments, accompanying people to appointments. Agencies also follow up with participants or service providers to see if services were obtained. For example, a participant may want to make a resource connection on their own, but may express some uncertainty or lack of confidence about doing so. And that could be an indicator to a community living connections partner that they should follow up at some point in the future. And these services, again, are provided over the phone, in person, or electronically. So the next service is options counseling. Options counseling is an interactive services to help participants make informed choices about long-term supports. A key component of options counseling is engaging with the individual through a person-centered conversation to learn about them, their strengths, preferences, and concerns. In addition to discussing and sharing information about resources, as is done in information and assistance, Options counseling assists the person in evaluating pros and cons of options. And this decision support process culminates in an action plan that outlines goals, tasks, responsible parties, and a plan for follow up. The plan in options counseling is really directed and developed by the participant with some support from community living connection staff. And we know that some community members need more continuous and hands on support and systems advocacy, and this is where care coordination comes in. Care coordination is short term case management for older adults and adults with disabilities who need assistance and don't have help from someone else to help them access and obtain resources. It includes an assessment, care plan development, and care plan implementation and monitoring. These services are available to older adults and adults with disabilities in King County who aren't receiving a Medicaid funded long term care service, who require multiple services or activities performed on their behalf, who aren't able to obtain those activities for themselves and don't have other supports to provide adequate assistance, and who have the ability to partner with a care coordinator and participate in care planning. Care coordinators have access to flexible funds to purchase goods and services to help support the care plan and help that participant remain in their community of choice. There is a screening and referral form for care coordination that's available for network partners and others to utilize. And now we'll round things out by talking about services for unpaid caregivers, which is referred commonly as the Family Caregiver Support Program. Eligible participants for caregiver services are unpaid caregivers living in King County. Families defined inclusively, so a caregiver can be a spouse, partner, relative, friend who's providing care to an adult with a functional disability. The caregiver can't receive financial compensation for providing care, and the care receiver can't be receiving a Medicaid funded long term care service like Community First Choice or CFC. And the care receiver can't live in a nursing facility or adult family home. This service, like many other services that we offer, are intended to delay utilization of Medicaid long term care services. Tailored Care Assessment and Referral, or TCARE, is an electronic assessment and referral tool used to tailor services and supports for those unpaid caregivers. This tool measures caregiver burden and stress and recommends services for the caregiver. The assessment process itself has several distinct levels and what's referred to as steps in TCARE. So you may hear TCARE steps. Step one is an intake. Step two is a screening to identify stressors and burdens and determine need for a full assessment. And step three is the assessment and care plan, with the care plan really being personalized to needs identified in the assessment. So, like services for older adults, adults with disabilities that I spoke about previously, caregiver information assistance is really opening the door and starting the engagement process with the caregiver. So, an eligible caregiver is making their first contact with an agency, often calling about services for a relative, whether that be parent or partner or friend. And caregiver information assistance is going to support them in navigating and obtaining services. At this point, agencies may refer to or provide other caregiver services prior to a caregiver completing the TCARE process. So, support groups, consultation, and training are examples of services that can be provided at any point before TCARE is complete. Other services are determined by the caregiver's status in TCARE. And those services include counseling, which is one-on-one professional mental health counseling focused on helping the caregiver manage and cope with their role. Respite care, which can be in-home respite, adult day, or overnight respite that provides care and supervision to give the caregiver a break. Emergency respite is available for caregivers in a crisis situation who have not yet completed the T-care process. And there is a flexible fund for purchase of tangible goods or other services that will support the caregiver on a one-time or short-term basis. There are resources available to partners in the Community Living Connections program. We have a website which includes a provider portal web space, and this web space houses documents for Community Living Connections staff, including a network charter and contact lists that shows who does what and how to get in touch with each other. Local forms, including agency referral forms and local policies. We cross-link on the portal to other important need-to-know information, including state policies, but they're worth mentioning in this presentation as well. Primarily the state's long-term care manual and their information assistance and options counseling standards. Get Care data guidance is available on the Aging and Disability Services website. New in 2023, ADS is going to be publishing compiled local caregiver support program policies and procedures. So this will take the place of individual documents that are currently available and bring it together in one cohesive policy and procedure manual. And the state, for their part, is going to be publishing community living connection standards that will take the place of information assistance and options counseling standards. So as a contracted provider in the network, you can rely on your grants and contract specialist to receive updates and information and to get connected to aging and disability services trainers if you have questions. Thank you for the important role you play in building a community where all older adults, adults with disabilities, and their families have the supports and services needed to thrive.